NCLEX RN Practice Answers 2026 questions to improve your accuracy. Question 1. A vaginal exam determines that the client's cervix is 5 cm dilated with 75% effacement. The client is in which phase of labor? Option A, active. Option B, latent. Option C, a transition. Option D, early. The correct answer is option A, active. The active phase of the first stage of labor is typically defined by cervical dilation between 4 and 7 centimeters. Question 2. A newborn with narcotic abstinence syndrome is admitted. Nursing care of the newborn should include: Option A, teaching the mother to provide tactile stimulation. Option B, wrapping the newborn snugly in a blanket. Option C, placing the newborn in the infant seat. Option D, initiating an early infant stimulation program. The correct answer is option B, wrapping the newborn snugly in a blanket. Newborns experiencing withdrawal should be kept in a low stimulation environment. Swaddling snugly helps provide comfort and reduces irritability. Question 3. Following the initiation of epidural anesthesia, the nurse should give priority to: Option A, checking for cervical dilation. Option B, placing the client in a supine position. Option C, checking the client's blood pressure. Option D, obtaining a fetal heart rate. The correct answer is option C, checking the client's blood pressure. Maternal hypotension is a common side effect of epidural anesthesia, which can lead to decreased placental perfusion. Question 4. The nurse is aware that the best way to prevent postoperative wound infection in the surgical client is to: Option A, administer a prescribed antibiotic. Option B, wash her hands for 2 minutes before care. Option C, wear a mask when providing care. Option D, ask the client to cover her mouth when she coughs. The correct answer is option B, wash her hands for 2 minutes before care. Hand hygiene is the single most effective method for preventing the spread of infection and protecting surgical wounds. Question 5. The elderly client is admitted to the emergency room with a suspected fractured hip. Which symptom is the client most likely to exhibit? Option A, pain. Option B, misalignment. Option C, cool extremity. Option D, absence of pedal pulses. The correct answer is option B, misalignment. A classic sign of a hip fracture is the shortening and external rotation of the affected leg, misalignment. Question 6. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to: Option A, lack of exercise. Option B, hormonal disturbances. Option C, lack of calcium. Option D, genetic predisposition. The correct answer is option B, hormonal disturbances. The decrease in estrogen production following menopause is the leading cause of bone density loss in postmenopausal women. Question 7. A 2-year-old is in Bryant's traction for a fractured femur. Which finding indicates the traction is working properly? Option A, the infant no longer complains of pain. Option B, the buttocks are 15 degrees off the bed. Option C, the legs are suspended in the traction. Option D, the pins are secured within the pulley. The correct answer is option B, the buttocks are 15 degrees off the bed. In Bryant's traction, the buttocks must be slightly elevated off the mattress to provide the necessary countertraction. Question 8. Which statement is true regarding balanced skeletal traction? Option A, utilizes a Steinman pin. Option B, requires that both legs be secured. Option C, utilizes Kirschner wires. Option D, is used primarily to heal the fractured hips. The correct answer is option A, utilizes a Steinman pin. Skeletal traction involves the use of pins, like Steinman pins, or wires inserted directly into the bone for long-term immobilization.